Thank everybody for joining us for our very first weekly Sacramento County Public Health briefing. I'm going to kick it over to our author, Dr. Olivia Exterier, and then she is going to hand it over to a couple additional staff that are an integral part of the COVID response. And then after they're done speaking, we'll facilitate a question and answer session. As I mentioned, this recording will be available after the meeting is over for anyone who would like it. So I will go ahead and kick it off to a reminder, please mute your phones and your Zoom so that we can hear Dr. K.
Good morning, everyone, and thank you for joining us. I'm very glad to be able to have some of our staff available as well to answer questions. So March 19th of 2020 was the day that we issued our first health officer order for stay at home. So we're actually marking 1 year since the first stay at home order that we issued. And it has been quite a long journey. Today, as of this morning, we are at 95,667 cases reported to us of COVID-19 and 1,559 deaths. And so we know that COVID-19 has had a very huge impact on our communities, on our families. But the good news is that today we are at a better point, at a better place, in that the numbers continue to decline. And the beginning of this week, we were notified by the state that we had met the criteria to enter into the red tier, which of course means that we're able to have schools open, and a lot of the businesses that were either closed or able to operate only outdoors are actually able to operate indoors. And one of the reasons that we are at this point is because of the vaccinations. And so I am going to ask Rachel Allen to give a brief update about where we're at with vaccinations in the community. And then Nick Morey will give an update about where we're at with school openings. So Rachel.
Hi, good morning. I'm the Immunization Coordinator for those of you that I haven't met. So we got our allocation yesterday, and this week we received 20,300 doses of vaccine. That's 11,700 doses of Pfizer, which is the second week that we've seen an increase in that. 7,300 doses of Moderna, still a little bit less than our all-time high, I think, which was closer to 9 or 10,000. And then we did receive 1,300 doses of the Johnson & Johnson. This week, starting on Monday, the 15th, we did see the state open up eligibility to people with underlying medical conditions, age 16 to 64. They are very specific, and there's guidance on our website as well as the state site to what meets that eligibility requirement. And we did also open up to public transit workers, including airport and commercial airline employees. And we have our website consolidated, all of the eligibility requirements, as well as the different sites where vaccinations can be obtained are on our public health COVID vaccine website. We're continuing to work closely with our pharmacies, with our partners, which are our pharmacies. We work with urgent care, medical providers, and I do hold a weekly call to support them, and we do support them as well with storage and handling issues and inventory management. Public Health is still operating the pod at Cal Expo, which primarily serves people who are eligible through workforce, and we're doing about 6,000 to 7,000 doses a week there. It's first and second doses, so it varies each day how many we're doing first doses and how many are second doses. We continue to follow state guidance, which is to prioritize second doses first, and then with any remaining balance of vaccine on hand, we use those for first doses, and we do advise our partners to do the same. We're also in a partnership with the Curative, who operates the site at McClellan, which is open to anyone who's eligible for a vaccine. And they're, I think, doing between 700 and 900 a day right now. And that's not quite capacity, but they're getting up to speed there. And again, they're doing first and second doses there as well. And we are looking to have a third site in South Sacramento. So that's still in progress, but coming soon. We continue also to work with community-based organizations. So some of the pop-ups you've seen each week that move locations, those are sites that we support, sometimes with logistics, but a lot of times with vaccine. We do have a health equity task force now that is helping us kind of look at those sites to make sure that they're meeting the needs of the community that's requesting those sites, that's the best location. We also this week started a concerted effort to reach out to people experiencing homelessness. So that includes the sheltered and unsheltered community. And we have some great partners that are assisting us with that. We are setting aside Johnson & Johnson vaccine for those outreach efforts, especially because that can be a harder population to follow up on. And that is a 1-dose vaccine. So it makes it really great to use for that community. And then we're also following up on the long-term care facility partnership. So CDC had partnered with pharmacies, CVS and Walgreens to vaccinate staff and residents in long-term care facilities. And that was 3 visits for each of the locations. And those are pretty much wrapping up. And so we're starting to backfill the need there. As you know, there's turnover with residents, people need to be vaccinated, and employees continue to need to be vaccinated. So we're working with some trusted local pharmacies, and then we have a strike team that goes out as well. And they're also working with homebound persons. So we do get requests here at Public Health for people who really can't leave their home. And so those are needs that we are actively able to, we have teams that can go out and work to get those people vaccinated. And then the last thing I would touch on is we're still onboarding to to Blue Shield, My Turn, and we don't have a lot of information still on what our role will be. We understand that we'll be involved still in the allocating process as far as being able to give input, but the allocating will be done by Blue Shield. So right now, Public Health is still allocating to our partners, but we do expect that transition to occur in the next weeks to come. And Nick, I'll pass it off to you.
All right, thanks, Rachel. Good morning. Nick Morey. I'm a member of our schools team. We have about a half a dozen of us that have been working to provide guidance and technical assistance to schools since last spring after the initial stay-at-home order and closure of schools in the spring. And the big news, of course, this week with the move from the purple tier to the red tier is an allowance for additional school openings. So as you may recall, last summer, schools were ordered closed by the state. They implemented a waiver program, and we oversaw the opening of approximately 50 schools during the fall through that process. And then during our stint in the red tier in the fall, schools were then allowed to open if they so chose. And we had a handful of schools locally that did that. And then when we were back in the purple tier and under the regional stay-at-home order, no new school openings were permitted. When the state released their latest guidance for schools in mid-January, that did provide a mechanism for elementary schools, grades 6 and below, who had not previously reopened to do so after submitting a COVID safety plan and some additional documentation to us and to the state. And we had several schools that did do that. And then by virtue of moving into the red tier earlier this week, that now opens the door for middle schools and high schools, so grades 7 through 12, to also be able to open. And it also removes the requirement for schools to submit their COVID safety plan to us for review. Our team continues to serve in a technical assistance and guidance capacity for schools. And so we have left the door open for them to continue to submit reopening plans for our review. And we will continue to provide guidance to them, even though no formal review is required. The other big news of late relating to schools is with youth sports guidance updates at the state level. So as I'm sure you're aware, many additional sports being allowed to play. This state did release guidance based on the tier system, indicating which sports may be played in each of the tiers, and added some additional provisions to that. So if certain conditions are met, specifically with consent and testing, it allows those schools and other youth sports programs to proceed to some of the sports that are specified in the lesser tiers, and do those in the purple and now red tiers. So we have had several programs that are moving forward with that. And I think I'll stop there.
Thank you, guys. Okay, so we're gonna go ahead with the question answer session because we have several outlets on that I anticipate will want to ask questions. If we can utilize the raise the hand feature on your Zoom, if you are on the computer, then I will call on you. And then if you can identify your name and your outlet before you ask your question, and then our available staff will answer the questions. So Tony, you can kick it off.
Thanks. Thanks for this. Let's see here. You know, you mentioned that you're not sure what's going to happen with Blue Shield, and I'm wondering, when they come in, are they definitely going to take over the dosage that you get, and that you won't get any more doses, and then you will lose control over how to distribute?
I'll take that one. So we're still working out the details of what our partnership with Blue Shield will look like, because we've been working very closely with the state California Department of Public Health. So trying to figure out what is going to change and how that's going to change. We have heard from them that there is a commitment to make sure that we do get our vaccine. And so we are working out some of the details of how that partnership is going to work.
Okay, Chelsea Shannon from ABC 10.
Hi, I just had two quick questions. Just to clarify, you're not expecting to get less with the Blue Shield taking over the allocations. You're not expecting to get less doses. And are we seeing any variants of the coronavirus vaccine in Sacramento County?
So we are not expecting to get less. We have been told that our allocation will remain about the same, but of course we get our allocation on a weekly basis. So, you know, we are going to wait and see what will happen. But right now, from what we've been told, it will remain about the same, which has been about 15,000. About the variants, we know that a number of the surrounding counties have had cases reported. We have not had any cases reported locally in Sacramento County yet.
Okay, I don't currently see any additional hands raised unless Tony has a follow-up question. And are there any other questions from our media corps?
I do have a follow-up, if nobody else.
Sure, go ahead.
You know, there's been so much talk about how the amount of doses coming to local localities is going to increase. We talked about that for a few weeks, but Dr. Caserio, you just said that we're not expecting at this point to get more in the coming weeks. Have you gotten some new news that says something's changed on that front?
We've also gotten the reports that there will be an increase at the federal level, but again, we have no, we haven't been given any details as to when that would occur. What we know from the state is that right now the expectation is that our doses will remain about the same.
For indefinitely, or for just the next few weeks, or?
For the next few weeks, yes.
And what's your prognosis for going to orange tier? Is it any shot in the next month?
That's a very good question. Nick, do you have any idea?
I'm notoriously bad at predictions. We do have to remain in the, per the requirements of the California Blueprint for a Safer Economy, we have to stay in a given tier for a minimum of 3 weeks. So we'll be here for the time being. I think the one major thing to watch for is, I think Dr. Caserio mentioned in the opening remarks about the vaccine equity metric. The 2 million threshold that the state met last week led to some adjustments in the thresholds for the red tier. The next threshold is 4 million statewide, which does lead to some adjustments in the orange tier and makes the orange tier more achievable. And so I think that will definitely be something we'll be keeping an eye on, because if we do reach that threshold, that would make it a little bit easier for us to reach that. But I think it is a good time to talk about the fact that while we are excited to be in the red tier and we're excited to be able to loosen many of the restrictions that have been in place, I think it's also a good time for measured response to that, and for everybody in the community to not get too carried away, so that we can, hopefully stay in the red and even move into the orange. We want to be very careful that folks are still being safe, maintaining distances, wearing their face coverings, and not gathering unnecessarily, so as not to create additional spread.
Okay, it looks like Chelsea has another question.
Hi, this one's for Rachel. I wanted to check and see where the third location for the South Sacramento vaccine site will be, and what is the goal of that new site?
I mean, I'm not sure that I'm the best person to speak about that. I think we're looking at several different locations. I don't know if Lynn-Ann or Mike want to hop in on that. I'm not sure it's been for sure decided, I guess I could say. Yeah, we're still in negotiations, so.
I can confirm that. We're still looking at several sites in the 95823 zip code area in South Sacramento. And the reason that we're targeting, sorry, I'm Jamie White with Sacramento County Public Health. The reason that we're targeting that area in particular is because of the disproportionate case rates. And it's in an H1 quartile.
Okay. Do we have any additional questions? If not, we'll go ahead and wrap it up, and I will make this recording available to all of you and anyone who may have missed this briefing. As we mentioned, we'll be doing this briefing every Thursday at 10 a.m. For the foreseeable future. And I will send out reminders every week leading up to the briefing. And we will continue to keep the similar format if this works for everyone. And with that, I will end the meeting. Thanks for joining us.